There are some symptoms and complications of diabetes that are uniquely specific to us women. I want you to know about them so that you can get the right treatment and avoid the more serious consequences. Today, let's see how diabetes affects women, what the complications are, and how to avoid all of those negative aspects. So first of all, if you are a woman with undiagnosed diabetes, you may experience many of the same symptoms as men, such as frequent urination, increased thirst, fatigue, or nausea. But listen carefully. These symptoms I'm going to talk about now only appear in women. Symptom number one is urinary tract infections or UTIs. Even though around 50% of women have had such an infection at some point in their lives, women with diabetes experience more frequent and more severe UTIs. You can have a harder time fighting the infection and are already at risk for kidney damage, which can become worse if the infection spreads. Now, that happens because the sugar in urine presents a breeding ground for bacterial growth. Urinary tract infections can cause painful urination and a burning sensation, and you may even have pain in the back or lower abdomen. Also, sometimes your urine becomes cloudy and even bloody. However, you may not have all of those symptoms, and they do vary from person to person. Okay, I know how unpleasant urinary tract infections can be, but ladies, you can help avoid them by following these steps. Step number one is keep your blood sugar levels as steady as possible. Having high blood glucose levels can increase your risk of a UTI. Step number two, make sure you empty as much of your bladder as possible when you pee. This can be an issue for people with diabetes and can contribute to bacteria growth that can cause infection. Step number three, don't ignore the urge to pee. If you have to go, you go. No more holding it in. Step number four, wipe front to back after going to the bathroom and wear cotton underwear. Also, know that a UTI is not the only infection that women may experience. Another symptom of diabetes in women is vaginal yeast infections. Now, the research shows that the weakness of the immune system and poorly controlled blood glucose levels can cause such unpleasant consequences. If your diabetes isn't well controlled, your blood sugar levels can spike to very high levels. Now, this increase in sugar can cause yeast to overgrow, particularly in the vaginal area. So what you need to do is to talk with your healthcare team if diabetes can be a factor in causing such infections. They will help correct any lapses in your diabetes management, and they will prescribe some medication to go ahead and treat the infection. And mild to moderate yeast infections can usually just be cleared up with a cream, an ointment, or a suppository, and the course of treatment can last up to 7 days, just depending on the medication. Okay, also you can prevent yeast infections by using the basic methods, and you know this, ladies, so avoid tight-fitting clothing, wear cotton underwear, avoid very hot baths or sitting in hot tubs, and change your tampons or your menstrual pads very frequently. Okay, now another symptom is oral yeast infection, or also known as oral thrush. Now, it is unusual for a healthy adult to get a yeast infection in their mouth, but when you have diabetes and high blood sugar levels, yeast thrives on the extra sugar that's in your saliva. Because of diabetes, you can also have a dry mouth, which helps the yeast take hold. The main symptoms of oral thrush include white patches in the mouth, swollen red gums or inner cheeks, redness and bleeding inside your mouth, as well as trouble eating or even trouble swallowing. Now, oral thrush can be prevented by maintaining good dental hygiene, by rinsing your teeth after eating, using mouthwash, and regularly visiting your dentist. Very important. All right, now let's step away from all these symptoms and infections for a bit, and let's give some attention to the Klinio channel by hitting that subscribe button. Guys, we truly care about your diabetes management, and we don't want you to miss any of our videos that have just such great information about it. All right, do it. All right, let's move on to another symptom, which is irregular menstrual cycles. Yes, ladies, you heard it right. Your unbalanced sugar levels can actually impact your menstrual cycle. Now, however, an irregular menstrual cycle is not only a side effect of diabetes. Menstrual cycles can also affect your diabetes management. Now, if you have problems controlling your blood sugar the week before your period, it may not be caused by anything that you are doing. In fact, it may be because of the changes in your hormone levels. During the menstrual cycle, changes in your hormones can affect insulin and your blood glucose levels. So, it can be a little more difficult to control your blood sugar the closer you get to your period. So listen up. It's super important to contact your doctor if you experience irregular menstrual cycles or if you find it hard to manage your blood glucose levels throughout your periods. All right, also before and during your period, you should check your blood sugar levels more often. You should include more physical activity that will help lower blood sugar and help you feel better emotionally. And watch your food intake carefully since hormones do change and that can also trigger hunger. All in all, it is really important to monitor blood glucose, mood, and eating related patterns with respect to menstrual cycles. All right, now go ahead and watch these videos on the Klinio channel and we will see you next time.